आज का टॉपिक है क्लैविपेक्टोरल fascia. Now this is very important short note, most of the time asked in the questions. It is also asked in the viva, specifically structure piercing the clavipectoral fascia. Structure piercing clavipectoral fascia, most of the time MCQ is also asked on this topic. So थ्योरी पॉइंट ऑफ व्यू, MCQ एंड वाइवा पॉइंट ऑफ व्यू, ये एक बहुत इंपॉर्टेंट टॉपिक है. सो लेट्स फोकस ऑन क्लैविपेक्टोरल फेशिया. बिफोर स्टार्टिंग द क्लैविपेक्टोरल फेशिया वी शुड हैव ओरिएंटेशन. तो अगर हम क्रॉस सेक्शन ले तो ये क्रॉस सेक्शन ऑफ क्लैविकल है, तो ये रहा क्लैविकल बोन. ओके, क्लैविकल के नीचे जो मसल इंसर्ट रहता है यहाँ पे, दिस मसल इज द सब क्लैवियस मसल. ओके, ये रहा क्लैविकल. फिर इसके नीचे उसी प्लेन में आता है एक और मसल, दिस इज पेक्टोरलिस माइनर मसल. ओके, एंड क्लैविकल से जो नीचे एंटेरियर टू पेक्टोरलिस माइनर जो मसल आएगा, ये वाला, दिस वन इज द पेक्टोरलिस मेजर मसल. तो ये रहा हाउ द मसल्स आर अरेंज इन दिस रीजन. नाउ इसके अराउंड जो ये रहेगा फेशिया, ये जो नेक रीजन से जो फेशिया आता है नेक से, दिस इज द इन्वेस्टिंग लेयर ऑफ डीप सर्वाइकल फेशिया दैट डिवाइड्स इनटू अ टू पार्ट. एक एंटीरियर टू द क्लैविकल जाएगा, एक पोस्टीरियर टू द क्लैविकल जाएगा. वही आगे चल के कंटिन्यू करता है, इसको सब क्लैविस को कवर करता है, एंड देन इट गोज बिलो टू कवर द पेक्टोरलिस माइनर, goes downside. Okay, in a anterior layer forms the deep fascia over the pectoralis major, और यहाँ पे आता है ये एक्सिला का फोल्ड. ओके, इस तरह से स्ट्रक्चर अरेंज है. नाउ व्हाट इज क्लैविपेक्टोरल फेशिया? सो क्लैविपेक्टोरल फेशिया इज द facial sheet. So it is the facial sheet which lies between clavicle, okay, and pectoralis minor. So it lies between these two structures. So it is the fascia which lies between the pectoralis minor and the clavicle deep to pectoralis major. Pectoralis major. So that is about what clavipectoral fascia. Okay, then we have to write what is the extent of the clavipectoral fascia. So extent vertically and extension horizontally. Okay, so vertically it extends from clavicle, covers the pectoralis minor, and then goes or blends into the axillary fascia. That is the extension. So in detail we will see vertically above the clavicle there lies the investing layer of deep cervical fascia. This splits into a two layer anterior lamina and posterior lamina which lies over the anterior border of the clavicle and posterior border of the clavicle. Then it descends downward and this fascia covers the subclavius muscle which lies beneath this clavicle, and anterior side and posterior side of the subclavius is get covered. Then it goes downward and this fascia is called as the clavipectoral fascia, and this clavipectoral fascia goes downside. Okay, this clavipectoral fascia from this above it is attached to the anterior to the subclavius and posterior to the subclavius muscle, and below it goes downward and covers this pectoralis minor muscle, and then again these two layers fuses with each other and goes downside and fuse with the axillary fascia, and this ligament which pulls this axillary fascia above is called as the suspensory ligament of axilla which maintains the dome of the axilla. Okay, so that is vertical extension. So clavipectoral fascia extends above to the clavicle enclosing the subclavius muscle. Below it splits to cover the pectoralis minor, then again rejoins to form the one layer and blends with the axillary fascia to suspend it above, that is called as suspensory ligament of axilla. All these structures lies deep to this pectoralis major, that is the vertical extension. If we see the horizontal extension, in the horizontal extension here lies the clavicle, okay, then below the clavicle here lies the first rib, ये रहा यहाँ पे sternum, okay, and this is the first rib. Below the clavicle यहाँ पे आएगा somewhere coracoid process, okay, and from the coracoid process there lies this pectoralis minor muscle, and this is what is the clavipectoral fascia, okay. And when it extends medially between this clavicle and this is the costal cartilage of the first rib, here lies the fibers, and these fibers are called as the costoclavicular ligament, costoclavicular ligament. And laterally between the clavicle and this is the coracoid process, and this is the clavicle. Between this there is the ligament that is called as a coracoclavicular ligament, okay, and this is the whole clavipectoral fascia, okay. So medially it goes up to the first costal cartilage and the medial end of the clavicle, where these fibers get thickened to form the costoclavicular ligament. Laterally this fascia extends up to the lateral end of the clavicle and the coracoid process, where there is the origin of pectoralis minor, and between these two, this is the ligament which form here is called as a coracoclavicular ligament. So that forms the coracoclavicular ligament. So that is the extension laterally and medially. Then the next part comes the structures piercing clavipectoral fascia. So again, this is the clavicle, this is the subclavius muscle, okay, then there is pectoralis minor muscle, okay, and then there is the pectoralis major, okay, and here we are drawing clavipectoral fascia, which encloses the pectoralis minor, goes down a deep fascia of pectoralis major, it lies over the axilla, dome of the axilla. So structures which pierces the clavipectoral fascia are, first one is the vein, that is nothing but the cephalic vein. Then there lies the artery, here lies the artery, that is nothing but the thoracoacromial artery. Then there lies the nerve, that nerve is the from the branch of the brachial plexus, this one is the lateral pectoral nerve, okay, and then there are few lymphatics. So structure piercing the clavipectoral fascia are, you can remember as a clap. C for this blue colored cephalic vein, L for lymphatics, A for artery, which artery? Thoracoacromial artery, branch of axillary artery. P for pectoral nerve, lateral pectoral nerve. Now in MCQ the ask the following structure pierces the clavipectoral fascia except lateral pectoral nerve, medial pectoral nerve, cephalic vein and thoracoacromial artery. The answer is except medial pectoral nerve. So which nerve pierces the clavipectoral fascia? Lateral pectoral nerve. That is important. So this much you can draw or write in the short note of clavipectoral fascia. The diagrams of structure piercing, enumerate the content which pierces, extension, how the horizontally where extends, laterally where extends medially. So medial में costoclavicle ligament, lateral में coracoclavicle ligament, vertical extension diagram, this you have to draw. Okay, and that's all about the clavipectoral fascia. You will get a full marks on this question. So if you like these videos, please share my channel videos to your friends. Thank you very much.